as Africa's population is expected to double by 2050 to 2.5 billion people. The continent faces a very critical challenge of creating the foundations for long-term inclusive growth. Now, one of these challenges call for renewed commitments and accelerated progress towards universal health coverage. And joining us live today on Close and Barely East Africa for a conversation on particularly this is Dr. Githinji Gitahi, Group CEO of AMREF Health Africa, and Evalin Karijo, Youth Representative for AHAIC 2019. And thank you very much for getting time to speak to us, ladies and gentlemen. Quickly just into this conversation, I think I want to start with the youth population because we expect it to be more than even 60% by the time 2050 comes upon us. How are the youth ready and how are they involved in conversations UHC? Evalin.
First of all, I like the fact that you acknowledged that the population in Africa is growing, and the fact that Africa is actually the most youthful continent in the world right now, because over 60% of the population is young. Under the age 24? Yes. Right. Which means that the only way in which that countries can actually reap the economic benefits and even increase their GDPs is if they have the youth at the center of their development plans. Right now, young people are actually ready to take on the challenge in being meaningfully engaged in policy and decision making. However, there are so many challenges that exist. One, the fact that youth are not being given the platform to be included in policy and decision making. Two, the aspects of capacity, the fact that policy has so much jargon. We need to ensure that young people are ready and even strengthened in terms of capacity to be able to take part in policy and decision making. Three, the aspect of resources. As you know, unemployment in this continent is quite high. So young people's priorities is all about trying to put food on their table. How will they get involved in policy and decision making in order to ensure that they contribute effectively to economic development? So these things have to be put into consideration and included in government priorities, if at all we need the young people to be a priority in this continent.
Dr. Githinji, bringing you into this conversation, do you at this particular time see CSOs, NGOs, and governments prioritizing the youth in such, big conversations like universal health coverage?
Well, to be honest, I think we can do more. I think what I see a lot of is kind of what I call tokenism, where, we need to include the youth. And at the same time, you get a youth on a panel, you get a youth organization being invited to a big meeting.
But they're not necessarily the center of that conversation.
The center of the conversation, So yeah, my answer to you is that we can, but we should do more. We should bring the youth to the center, not only to participate, but to lead the conversation.
Right.
And if you look at the population you're talking about, if 60% of the youth are under 24 and 75% under 35, you're basically saying that this is the biggest population.
Right.
So they own the continent for now and for the future.
Right.
So how do we flip the pyramid so that the youth actually take the leadership? Because they're building a future for themselves.
Right.
By 2030, I'm going to be above 60 years, But by 2030, Evalin will still be in the prime of her life.
Right.
So how does she start to participate now in building the continent she wants to see by 2030? We have to give way. We have to only just guide and give a bridge. And that conversation has to be meaningful.
Right.
Yeah.
We definitely have been seeing a trend in poverty reduction with different governments. But when we look at the case of population growth, of course, numbers here matter a lot. I just want you to give me a quick sense into what are we looking at as the case for universal health coverage? How much people are rendered into poverty just because of having to take out some of their budget to take care of the healthcare?
Well, we know, globally we are talking about 800 million people who have to spend over 10% of their livelihood to actually take care of health. And this 10% is people, there was a study that was done that actually said that a lot of the informal people in rural communities in Africa have 5 to 10 jobs to make a living. 5 to 10. You see, for you sit here, you get a salary.
Right.
The people who live out there in the village have to sell chicken, then they burn charcoal, then they also polish people's shoes, and then over this, they end up making $80 a month. So they collect it from multiple sources. Now, when that person gets sick, all the sources of income collapse. So even other than spending above 10%, it actually pushes them, when they're sick, it pushes them to impoverishment. We know that over 100 million actually get poor every year because of health costs, so it's significant. And therefore, the question to ask is, what social protection processes and mechanisms do governments have to put in place to make sure that people do not have to worry about finances now when they are seeking healthcare? Now, the critical issue here is that there are many other things that people need. People need water, people need electricity, people need this. Why health? You know, why are we talking about social protection for health and not discussing social protection for transport or social protection for water? It's because health is the most fundamental human right. And without health, none of the others can be enjoyed. A child we see can go to school. An adult we see can go to work. So health is actually an investment for every country. So we must think about these issues and disaggregate the numbers, because I think what we don't know more of is we look at this 800 million, this 100 million, and we look at it as a number. But if you disaggregate that, you'll see that women and children are more significantly impacted. People in marginalized communities are more significantly impacted. So we also have to disaggregate the numbers.
You're very passionate about this, Dr. Githinji, but I'd like to definitely bring back Evalin into this conversation, because it kind of also looks at her so much. Because for one, she is a young African lady and also a youth. Evalin, how are you, the young people of this continent, changing the game when it comes to universal health coverage? What are you doing differently at this point?
What I like about what we young people are doing now is that we are no longer taking the back seats and waiting to be invited either to give our views or to take part in decision making. We are actually demanding for it. We know it's our right to take part in policy making. We know it's our right to give inputs to matters that affect us. And I'll just give an example of how when we held the very first Pan-Africa convening of young people, we had over 250 young people coming together in 2017. We came up with this powerful statement saying nothing about us without us. And we say that whenever governments are coming up with policies on issues that affect us, including sexual and reproductive health and rights, issues of protection on gender-based violence, issues of HIV and AIDS, young people need to be at the forefront. So what we are doing right now is taking charge of this space and these platforms and having our voices heard.
Let me get back to you just a little bit there. We did see about 36 youth traveling from Nairobi, about 1,000 plus kilometers, over 1,500 plus, to Kigali, and they collected, information along the way. What are some of their asks? What are some of the things that are like, okay, this is not happening in this region and we need to call on the government? Just brief me on that.
The Road Fest and the Caravan was one of the brilliant and brightest ideas that the young people came up with. One, because we knew that we needed to include young people who could not afford to come to Kigali to give their views on universal health coverage. So what you said is that we will not take flights, let us go by road because we cannot afford. And in addition to that, let's have activation stops in 5 towns across East Africa and collect views of young people on UHC. And we actually collected views of over 400 young people from Nairobi, Kisumu, Kampala, Kabale, and finally Kigali. And one thing that the youth said is that UHC is a good approach. It's something that the UN and the global community have reiterated as one of the actually biggest social equalizers in terms of reducing inequalities and ensuring that economies do not just focus on health, but also economic advancements. And we say that one, young people need to understand what UHC is. So they said right now it's a gap. Young people do not understand how UHC will actually benefit them, what it comprises, how we need to take part in order to contribute to the advancements of UHC. So one of our asks was to make sure that governments have a policy in place for young people to be able to understand what UHC is, and the fact that it's all about young people first accessing the services that they need, whether or not they can afford for it. Secondly, we say that youth need to be involved meaningfully, as Dr. Githinji has put it. It shouldn't just be about young people being called to meetings. We need to make sure that our views are heard. So we said governments, one, need to set up advisory boards for UHC in each country, or they can leverage on the existing structures and ensure that youth are engaged in policy making at the very highest level. 2, I've talked about capacity strengthening. 3, investments in health. The fact that countries have not been able to allocate at least 15% of their budgets as per the Abuja Declaration has also had an effect on the quality of services that are being offered. So the youth said, in addition to financial constraints, we need to ensure that services that are being offered to us are quality.
Right.
If it's about information on SRHR, is it the right information? Investments, even in the health workers who provide this information to us, needs to be at the very fore of their planning, so that health workers who are serving youth need to be able to maintain confidentiality, need to have the right attitude. All that needs investment.
All right.
Those are the key asks for us.
All right. And I hope definitely we will get to hear a comment from the governments about that as well. But then, Dr. Githinji, before I take my last question, I just want to come to you again. We only saw Ethiopia and Rwanda registering progress out of the 54 countries that are on the continent towards universal health coverage. What are we looking at for the UHC framework for Africa? Is this also part of the conversations that we are looking at the conference here in Kigali?
Yes, you know, the UHC framework is based on some of the issues we are discussing here, is based on first creating quality systems that are responsive to the underprivileged. UHC is a lot about those who have not,
right,
rather than those who have. It's about equity rather than equality.
Right.
So all these things, you know, come to the fore. But most importantly, it's also about primary healthcare.
Right.
UHC is about essentialism, like what are the services that are essential to the people first,
right,
so that you know, a dental aesthetic is less important than maternal delivery. You know, so you have to decide what to focus on. And therefore, when you come down to primary healthcare, the question is which countries in Africa are actually making progress on primary healthcare,
right,
towards UHC. And I think when you look at the countries, Rwanda is way up there, and Rwanda is not only way up there in terms of primary healthcare systems,
right,
and community health systems, but also in financial protection. Ethiopia is ahead in primary healthcare, community health systems, but still has to work on its financial protection. Right. It's just starting to set up that. So we have a framework, and the question is, how do we use this framework for every country to start showing progress? So that will also be a conversation with the ministers, private sector, the youth, and CSOs that are representing other constituencies.